Hello everyone, welcome to Dentospedia, which is the most trusted platform for any dental board exam. So today we are going to study viral infections of the oral cavity from the module of oral pathology. So let's begin with the topic. Viral infection causing oral ulcers. So see, viruses commonly cause vesicles, small fluid-filled blisters in the mouth. Now these vesicles rupture quickly and form painful ulcers. So main viruses involved. So see, herpes simplex virus, HSV1 and HSV2, Coxsackie virus like herpingina and hand-foot-mouth diseases. It can cause herpingina or hand-foot-mouth disease. So see, first we'll study herpes simplex virus HSV1 and HSV2. Understood? So see, herpes simplex virus, the lesion will be vesicle and ulcers. Understand? And it will mostly be seen in anterior oral cavity involving lips, gingiva, tongue, or buccal mucosa. Now there will be high fever and which will be more prolonged. Understood? So there is primary herpetic gingivitis. So see, it is mostly seen in children and immunocompromised patients. Now there will be multiple painful vesicles and ulcers on the lip, gingiva and tongue. Now there will be prolonged fever, lymphadenopathy and malaise. Understood? Now see, you can see herpes simplex virus. You can see over here, it is a herpes simplex virus. You can see there are vesicles, multiple vesicles. Understand? So HSV lesions appears as vesicles that rupture. So it will rupture and form into ulcers. Understood? It will rupture and forms the ulcer. Now, recurrent herpes labialis or cold sores. See, trigger points are stress, fever and UV exposure. Understood? So what are the clinical features? See, what are the clinical features? So there will be painful clustered vesicles. There will be a painful clustered vesicles on the lip border or on the vermilion border. Understood? Now lesion crust and heal. So see, the lesion will crust and heal. So see, HSV lesion always begin as vesicle that ruptures to form the ulcers. So now what are the diagnoses? So see, there is a Zank smear. Zank smear for multinucleated cell and PCR. PCR is polymerase chain reaction. Understood? Or viral culture which is more definitive. Understood? PCR or Zank smear. See, Zank smear is non-specific or PCR or culture is more definitive. I have told you, and the treatment, the drug of choice will be acyclovir or valacyclovir. Essentially effective if given early. Understood? So it is recurrent herpes labialis. So that was viral infections of the oral cavity. So for more detailed video, please download our app Dentospedia and please do like, share and subscribe our channel. Thank you very much.